Today at Oakton EMT, we're going to talk about airway management. We're going to talk about the 3 basic skill sets for airway management. We're going to talk about the administration of the oropharyngeal airway, the OPAs, as you can see in my hand, the nasopharyngeal airways, NPAs, and then we're going to talk about suctioning our patients. Before I dive more into suctioning of our patients, I'm going to talk about our mannequin that we'll be using, our airway mannequin, and then the BVM device that we'll be using. Our BVM mask with reservoir bag, supplemental O2 attachment, and then capnography to measure the CO from our patient that they're off-gassing as we're ventilating our patient. I'm going to focus right now on our suction unit. Prior to doing any of our skill sets, prior to your duty day, you always want to test your equipment. So to test your suction equipment, you always turn it on, test the suction, making sure it maintains at least 300 millimeters of mercury of suction for approximately 30 seconds, for 30 seconds. Once you determine that this patient or the device has been able to sustain it, you can shut it off, and now we'll begin our scenario. Like every scenario that you'll be doing in your EMTB practicals, you always start off with BSI scene safety. Once the proctor tells you the scene is safe and you do actually have your body substance isolation on, you begin the scenario. For this case, for our scenario here, is we're using our BLS airway adjuncts. As stated earlier, the oropharyngeal airway, the OPA, and the nasopharyngeal airway, the NPA. Prior to actually determining or using it, you want to first determine the responsiveness of your patient. How you determine the responsiveness of your patient is you shake them vigorously to see if there's any type of response. Or for this case, what we're focusing on is we're determining to see if this patient has a gag reflex. Now, when you rub your finger across their eyelashes, this does not specifically state that the patient does or does not have a gag reflex, but it does show if there's a responsiveness of your patient. Now, specifically, we're going to be talking about the oropharyngeal airway, the OPA, the indications versus the contraindications. The indication of when to use the OPA is if the patient is unresponsive without a gag reflex. The contraindication for the OPA is if this patient is responsive with a gag reflex. So we've determined that there's no gag reflex for our patient. To open up the patient's airway, a simple head tilt chin lift maneuver will open up the patient's airway. Now, prior to inserting the OPAs, we need to measure the OPA. Measurement of the OPAs from the corner of the mouth to the corner of the earlobe, following the patient's crown, as you can see like this. I know some of the literatures may tell you to do it this way. It's frowned upon. Corner of the ear, corner of the mouth is how you measure the proper use of the OPA. Again, I already opened up the patient's airway. Once you do that, you insert it as a J, hit the hard and soft palate, rotate it, and it lands right behind the tongue of your patient. As you can see, the phalange is on your patient's lips. The question is always brought up, what happens if this patient begins to gag or starts to vomit? If they begin to gag, there's 2 different techniques that you would do to remove the OPA. The first one is the most easiest one. You take it straight out. The second one, again, different authors, different books, and different clinicians will tell you, you turn it 90 degrees and you take it out on the side. Does it really matter which way you remove the OPA once this person regains consciousness or starts to gag? No, it does not. Once this is in the patient's mouth and you're going to be properly ventilating your patient, you separate your bag valve mask from the actual mask. You attach your capnography, attach it together, and then you start ventilating your patient with the C&E method. What we're looking for, like all of our ventilations, is good and equal chest rise and fall. Now the question is brought up if there's vomitus in this patient's throat. So now we do have, if there is vomitus, we have to remove or suction out the vomit. So you remove the OPA, you can turn him to the side, let the stuff come out of his mouth. But in this case, we've already done that. We've attached the Yankar to our large tip border. Turned on our suction unit. For this Yankar, there's an opening here in the Yankar. You have to close it as you're suctioning on the way out. When it's open, there's no suction, but once you close the circuit, now you do have suction. Prior to inserting the Yankar tonsil tip rigid catheter into the patient's mouth, you have to do two different things. One, you can measure to see how far you're going to go, or as different literature will tell you, you insert it as far as you can see. Once you insert it, you close it, complete the circuit, wand-like motion on the way out for 15 seconds. Once you clear all the mucus out of the patient's throat, you flush it out, and then your partner is going to be ventilating your patient for approximately 2 minutes after you're done suctioning. I will simulate the ventilations. The instructor will tell me that there's actual mucus now in the nasal cavity. So if I do have mucus in the nasal cavity, same concept. You'd measure from the corner of the ear to the corner of the nose or the tip of the nose, and we'll talk more about that with the NPA in a second. Once I determine the length, I insert it, I complete the circuit, twist it in my fingers for approximately 15 seconds on the way out. Same thing, flush it. My partner will ventilate and then suction as well. Clear the line. Now, some people might ask if there's actual mucus around. Let's say if this patient does have a stoma, right? There's mucus around there, there's dried up mucus. You need to suction it out because you can see just all the mucus building up. It's kind of hard to suction dried up mucus around the stoma. So what you would do, it's recommended, is you would take a 4x4, moisten it up with some sterile saline, moisten it on there, get it nice and loosened up, and then you suction that area clear. The next airway adjunct we're going to use is something called the nasopharyngeal airway, the NPA. So prior to actual insertion of the NPA is we're going to need to determine the indications for it. So there's two things. There's an indication and then there's a contraindication. The indication is the patient is positive for a gag reflex and is responsive. The contraindication is, and we're going to keep it very simple for the contraindication, if the patient has any form of facial trauma. Keep it very simple. Facial trauma is the biggest tell for your contraindication for an NPA. I'm going to first grab the appropriate size nasopharyngeal airway and I'm going to measure it. You're going to see some of the literature will tell you, you always start off at the corner of the ear to the tip of the nose, corner of the ear to the tip of to the corner of the nose. Either or is the same one. It's the same answer, depending on the literature that you read. In our book that we're using, it's corner of the ear, corner of the nose. So now I've determined the appropriate size. Prior to insertion, you want to do two things. Make sure the bevel is towards the septum, and then you lubricate it with a water-based lubricant. So I've lubricated my nasopharyngeal airway. I'm preparing to actually insert it in the nasal cavity, bevel towards the septum. Now, if you do get resistance when you're inserting it in the nasal pharynx, you remove it, re-lubricate it, bevel towards the septum as you're inserting it, and then rotate it as you're inserting it. Once you've fully inserted it, you do the same thing that you were doing with your OPA, is you ventilate your patient, looking for good chest rise and fall. That concludes our demonstration of airway management or airway adjuncts with our OPAs and our NPAs, in addition to proper use of the suction unit. If you like us, follow us on Oakton EMT on Facebook and Instagram. Thank you and have a wonderful day.